So, employee health is a very important job and very important role. So is infection prevention. When you add those two together, now this individual is trying to figure out which is more important. What do I prioritize versus not prioritize? And it's a big conflict internally for the individual, especially if they're passionate about what they're doing. It's just not a healthy balance. And making it a healthy balance is just unrealistic. And especially during COVID, when we were grappling with sick employees as well as figuring out when people can come to work, hospital administration is trying to figure out staffing because we need to keep hospitals operational because of the influx of COVID patients during the surges. And you also have lots of changes in guidelines and recommendations. Remember those days when the CDC was updating guidelines every day at 4 p.m. And it's so the IP has to be on the front line trying to help the frontline teams educate them on these new guidelines and what they need to do. And you can't do that while you're trying to serve those employees that are sick or that need employee health. And I think reality just hit quickly, and the organization realized we are setting these people up for failure. They can't do both of these important roles at the same time. And I think oftentimes what happens is when you put someone in that position, employee health, a lot of it, what they do is required by law, it's regulatory. And so that becomes priority, and infection prevention just kind of falls on the lower end of that long list. And so that's what we needed to speak to. Is like infection prevention is very important. It's not a role that you kind of keep on the side and pick up when you can. It has to be an active role every single day. And we can't do that if we are not able to really look at these roles and separate them so that we can have individuals that can focus on each of these very important roles and be able to do the work that we need to do for our healthcare workers. They deserve it. And I think that kind of was the message. But it just became quicker. People were just burnt out. People wanted to leave the roles because they were being asked to do too much and they can't. And if you're like me that cares about what you do, you go home feeling like you have not accomplished anything because you're just running around, not able to meet any of your targets for the day. And it's just been an addition to the burnout that was already happening during COVID.